number 3 is about a patient called Trav. He's aged 65 years old and he presents to your GP clinic with his wife. He tells you that he had a funny turn this morning and he has completely recovered and made the appointment as his wife's insistence. He says he first noticed something was wrong when he answered the telephone call from his sister and found it difficult to speak. His wife reports that his words were muddled and he had difficulty making him understand. She thought he seemed confused at that time. Your task is collect further focused history, ask for the examination findings from the examiner, and discuss the probable diagnosis and treatment advice with the patient. In a case like this, what you're going to be thinking about is it a syncope? Is it a seizure, migraine, or is it a cerebral tumor? Is it hypoglycemia or hyponatremia, delirium, head injury, or a transient ischemic attack? Or it can be a somatization, but this is a diagnosis of exclusion. In this case, if you ask about the history, you will get the answers from the wife. It was very difficult to understand what he was saying. Words were not coming out. And he took 5 minutes to become normal. His past medical history is only about hypertension and he is on Coversil. If you ask for the examination findings from the examiner, he will tell you that Trav has a BMI of 27 and his blood pressure is 150/90, and the rest of the physical examination is all normal. Don't forget to ask about the neurological examination as well, because this might be a case of stroke. From the findings we have in this case, it is apparent that this is a transient ischemic attack. A transient ischemic attack is a transient neurologic dysfunction in the brain, midbrain, brainstem, and optic nerve due to ischemia that lasts for less than 24 hours and usually resolves completely. It is of a sudden onset. Consciousness is usually preserved, and it is very important in the physical examination to do fundoscopy and to check for the carotid bruit. Now, coming to the ABCD stroke risk tool. This is a very important tool that you have to apply for every single patient that you think has stroke, has TIA, or has a high risk of getting a stroke. A is for age, B is for blood pressure, C is for clinical features that the patient might be experiencing at the time where you're reviewing him, like unilateral limb weakness or speech impairment without weakness. D is for duration, 60 minutes, a score of 2, less than 60 minutes gets a score of 1. Another D is for diabetes. Patients who have diabetes get a 1 point. The maximum is 7 points. More than 4 points is high risk and you should refer to a specialist. Less than 4 is a low risk, and what you need to do is just continue follow-up. Now you need to think, is this a stroke or not? Think fast. So FAST. F is for face. Ask the person to smile. A is for arms. Ask the patient to raise both arms. S for speech. Ask the patient to speak or say a simple sentence. And T is for time. Is it within 3 hours or not? So if the patient was able to do the 4, it's unlikely that it is stroke, although it's not an exclusion. It is very important to then go to the next case and discuss the management. To explain this to the patient, you need to say, one of the vessels supplying a part of your brain is blocked by a clot for a brief period of time, which causes a decrease in oxygen supply to that particular area of the brain temporarily. This is what we call a mini stroke or TIA, transient ischemic attack. Most symptoms disappear within an hour or less than 24 hours. Most symptoms disappear in less than 24 hours. It might have come from the heart, or the clot might have formed in one of the vessels of the brain. It is usually due to cholesterol deposits in the vessels, and these are called plaques. It is considered as a medical emergency and taken as a warning sign for future brain attacks. In all patients with TIA, you need to refer them to the ED, local emergency department, or admit them to a stroke unit as soon as possible, so that they will be seen by a neurologist and be further assessed. These patients need to do urgent bloods, full blood count, urea electrolyte creatinine, LFTs, ECG, echo, thyroid function tests, clotting profile, hemoglobin A1C, and a CT scan of the brain, and carotid Doppler. The current research says that 20% will get a stroke in the next 6 months, and 50% of these people are at risk of getting full-blown stroke within the next 24 to 48 hours. So that's why, even if the symptoms resolved, it's very important to still refer them to the local emergency department, and they will be admitted for follow-up, and the follow-up should continue as an outpatient after that. Also, in this patient, don't forget that there is a BMI of 27, which is a cardiovascular risk. So this patient will need further discussions about lifestyle modification, which is healthy eating habits, exercising every day for half an hour, and assessing other risk factors, for example, whether he has diabetes or not, and other risk factors.